Welcome to our COVID-19 update, where we'll be talking to Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister. Good morning, Minister. How are you?
I'm doing okay. Thank you.
So this morning, I would like to touch a little bit on the ICU at Ocean View. I remember you saying that it is supposed to be completed by the end of the week. And with that, how is the staffing capacity?
So the ICU at Ocean View, we have been working at that now for maybe about 2 to 3 weeks, and we have been able to install the um, oxygen lines, the suction lines, and other gas that is needed. So that has now been completed. The oxygen banks and so forth are all in place, and we are now moving in the beds that would be there for the ICU. We'll have about 25 beds in the ICU proper, and then we'll have some additional beds in the theater and theater recovery area. So in total, we'll have about 29 beds in that whole area that would now be the new ICU. In addition to that, some of the equipment that we have currently at the Georgetown Hospital Infectious Disease ICU, we'll be moving them across because we'll discontinue the Georgetown Infectious Disease ICU in large parts. We'll still maintain maybe a minimum presence at Georgetown Hospital, but the idea is to move everything across to Ocean View. In addition to some of the equipment that we'll be taking across, we also have equipment that we would have bought, new pieces of equipment, ventilators and so forth. So those we are now installing, and we want to start that transfer process by next week. Once we complete that, then at Georgetown Hospital, we'll be able now to return to some sense of normalcy where we'll be able to see more patients at the hospital. I think they have been restricting patients because of COVID-19 had taken up quite a number of bed space at the hospital. So by decanting these patients over to Ocean View, we'll now be able to take in more of the regular patients at Georgetown Hospital. In terms of staffing, we do have the staff that are currently operating at the Georgetown Hospital, the infectious disease ICU. Those staff would be going across to man the new ICU that we have. And also we had a number of other persons that we brought on maybe about a month ago. So they would continue to be part of the staffing arrangements. So I think for staffing, we have so far adequate staff. We are also looking at training people continuously, and there would be a number of training sessions that are coming up, inclusive of training that would be done by the U.S. government. We expect a team to be in here in a week or so, and they would be doing training, hands-on training in a number of our regional hospitals, and we'll also do some sessions with the doctors at the Georgetown Hospital.
Okay. So thank you very much, Minister, for that. Now, with regards to treatment of patients, you mentioned with the drug remdesivir, a patient would require more than one dose. Can you expound a little bit on that?
Yeah, well, remdesivir is one of the medicines that we've been using to treat severely ill patients or critically ill patients. And generally, when you start a patient on remdesivir, it means you'll have to price them and to see how much they would need. We tend to probably look at maybe between 5 to 10 days of treatment. Sometimes it can be longer. And every day then you would have to use a vial of remdesivir. So depending on whether you do a 6-day course or a 10-day course, you can see how much remdesivir we would need. It is quite an expensive drug, but nevertheless, this is our protocol and this is what we've been using. It's a standardized way of treating, so we are following those protocols. In addition to remdesivir, we've also been using dexamethasone for some patients if we feel there's a need for that. and there's some other medication. Now, what one should bear in mind is that none of these medications are really specific to COVID. There's no specific drug for COVID, and a lot of these medicines have been repurposed to help with the treatment of COVID. Right now, globally, they're now trying to develop more specific medicines for COVID-19, but as of now, we don't have a specific drug for COVID-19.
Okay. Thank you for that, Minister. Now, moving on to the situation in Region 1, do you have any updates for us?
Region 1, I would say, remains stable, especially the Quibana area. We have 52 cases, which there's a slight drop from maybe 2 days ago when we had 62 cases. So we've been able to discharge about 10 persons. And the surrounding communities, we had done some checks to make sure that, and to identify if there were people who were in contact with the residents in Quibana, if they're testing positive. Unfortunately, we did find a number of persons. I think there are about 17 persons that we found. And we have since been able to isolate them and to explain to them the measures that they need to follow. We have a team now that is present in Quibana, and if persons need additional care, that team would be able to provide the care. And what we are monitoring for is, because most of these persons are mild, moderate kinds of symptoms, so what we are really monitoring for is to see whether or not persons would have difficulty breathing, and if they do, then we'll have to bring them more into a hospital setting. So we continue to monitor, and I expect that we'll be able to reduce the amounts of positive that we are seeing right now in Quibana in another week or two.
Okay, let's talk a little bit about Colby Curb. How has that been going?
I think so far we have been getting good response, and we have been tweaking the message depending on the feedback that we are getting. I think by and large, most people know that they need to wear a mask, they need to sanitize, they need to keep safe distances. And so as we get feedback, we try to tweak the message, trying to address myths that people might have in their minds. So we would, in the near future, be bringing out some new messages. As you know, we had developed some pamphlets and so forth that we were circulating, so we will add new messages based on the feedback that we are getting. But I think with the joint services, they have been able to assist us greatly going out into communities, talking to people. Of course, we can strengthen our enforcement a little bit. That is something that a lot of people have been complaining about, and we have been working with the police to ensure that we strengthen this aspect of it. There are some areas that I would say work better than others, but it's an ongoing effort, and I guess we'll have to improve in those areas where we are not so strong.
Okay. Given the current weather situation and in light of flooding, what advice would you be giving to persons?
Well, with the kinds of rainfall that we have seen, we have some additional challenges that we have to consider, because with rainfall, with flooding, you can easily have waterborne diseases. So to prevent waterborne diseases, one would have to take additional precaution with the water that you're consuming, boiling the water to make sure that it's germ-free. So that's one of the advisories that the Ministry of Health has put out recently. In addition, we don't want people to be playing in stagnant pools of water, because there again, they can come in contact with various bacteria and so forth. And you then would be, a lot of the kids would develop rashes and things like that. So what we want to do is to prevent that. And to prevent that, you have to stay out of these contaminated, stagnant pools of water. So we have issued some advisory pertaining to that, how to keep your water supply safe and to consume safe water. And the safest way to do that is ensure that you boil it. and then to stay out of these stagnant pools of water that we've been seeing around the place. In addition to that, you know, when you have flooding in a yard and so forth, rodents and other vermins that you would have in and around the house tend to seek higher ground, and one would also have to be look on the lookout for things like leptospirosis and so forth. So we, in the health system, we have been able to, we see seasonal flux of some of these diseases, but if persons take precautions, we can prevent a lot of it. During the time when we have these rainy seasons too, because sometimes people don't take precautions, we'll see the incidence of diarrheal diseases going up. But again, if people take precautions, we can reduce the amount of diarrheal diseases that we're getting. And these predominantly affect children. They're more vulnerable to these things. So again, we're asking parents to be more cautious and to get their children to drink water that has been purified.
Okay. So, wrapping up, Minister, you recently visited Regions 2 and 6 as part of your mandate as the Health Minister. Tell us a little bit about your assessment.
Well, in Region 6, we've seen a number of things that we need fixing because both the infrastructure, the systems that they have in place, there are lots of things that we need to do. We've had the opportunity to interact with the staff. We have pointed out some of the challenges that we have seen, and we've already started to take actions to remedy that. So one good example is that the diagnostic capacity in Region 6, for example, X-rays, they have a challenge with that. We are trying to fix that. We have been able to get the CT scan up and running, so that's a positive. They've had major challenges with supplies of medicines and reagents. Because of the emergency procurement that we've done in the ministry, they are now able to get a lot of the medicines that they need. A lot of the doctors too have been restricting services because of COVID. We are now expanding these services, so we've asked them to reopen many of the clinics and so forth. So this is the kind of ongoing work that we are doing. And of course, we want to improve the services that we are providing there as well. So we'll be talking to them on how we can improve those services in Region 6. Region 2, we had a similar exercise where we engaged the staff and you know, we were able to get a first-hand appreciation of some of their challenges. And again, with the interaction, we're coming up with solutions on how we can fix it. Across the system, we have seen shortages of medicines, shortages of laboratory reagents, so they can't do laboratory testing. Medicines such as HIV and so were short. So these are things that we have been able to fix over the last month or so, and we'll continue to do that. In Region 2, we'll be working with them. We have already spoken to them about Indian grant that we expect to come into effect next year. And with that grant, the Saudi Regional Hospital will be doing a substantially new, I would say, hospital, because we'll be investing maybe about $6 million in that facility. So we've had some discussions on that as well. And I think it has been well received by the region. We are also looking at some other infrastructural projects that we want to have there. And of course, the medical staff that we have deployed there, we want to see them being utilized optimally. So these are all things that we are working on.
Okay. Thank you very much, Minister.
Okay, thanks.
That's it for our COVID-19 update. For more information, visit our website at dpi.gov.gy or follow us on our social media platforms.